In this video, I'll walk through how to use the TreatGx software. We call TreatGx Medication Decision Support Software because the software identifies and helps to narrow down the list of potential medications that can be used to treat a condition. TreatGx is designed to help patients and their healthcare providers identify the safest and most effective medications for individualized treatment of a condition. The software does this by using important patient-specific information, including genetic information from the TreatGx genetic test, weight, height, past and present medications, and many more factors. To use the TreatGx software, you must have a healthcare provider account. For information on creating an account, see the Registering for an Account videos. From the TreatGx homepage, click on the correct region, US or Canada, in the top right corner. This will bring you to the login page for that region. After logging in, this is the homepage you will see as a healthcare provider. On the left-hand side is your case list. You can search for patients by typing their name in the search bar, or you can view all your patient cases by clicking the list icon. Just below this is a running feed of new features, TreatGx updates, and other important news. Clicking on a post will take you to the relevant page on the TreatGx website. Let's search for a patient. Here I've typed the name Julia and click the search button. After you select a patient case by clicking on the correct name, a list of navigation options will appear on the right-hand side. You can follow any of the navigation links to access patient-specific information. It is best to start by entering current conditions. This is the current conditions page where you can see a list of all conditions that currently exist in TreatGx, sorted by body systems. These are the conditions for which you can see personalized medication treatment options. One by one, select all the conditions that your patient has. If your patient has already entered this information using their own personal account, you will see this information here. You can deselect conditions and select alternative conditions if you do not agree with what they've entered. In this example, I've selected hypertension, type 2 diabetes, gastroesophageal reflux disease, and depression. After you've selected all the relevant conditions, click Save. Next, let's enter medications that the patient is taking or has tried in the past. TreatGx considers current medications when it generates personalized medication treatment options. However, if you want to save time and skip this step, it can be done later. You can navigate back to the medications page by selecting the icon at the top of the page, or by going back to the home page and selecting current medications. Medications should be entered under the condition they are being used for, if possible. If the condition is not yet included in TreatGx, the medication should be entered under Other. Simply start typing in the name of the medication, either the brand or generic name, and a drop-down list will appear. Select the correct medication and strength, and it will appear in the medication list. To enter past medications, enter the medication in the same way, but select Past, and give the reason why it was stopped, either not tolerated, not effective, or if it simply isn't needed anymore, select No Issues. This will help generate even more personalized medication options. Now let's start TreatGx to get medication treatment options. Select the Options icon in the top right to take you to the Medication Options page. On the Medication Options page, you can see all the conditions that have been entered in the Current Conditions page. Select a condition to get started with generating medication options. In this example, I've selected gastroesophageal reflux disease, or GERD. When you first use a condition, you will notice that some fields might have black text and some fields have blue text. Black writing indicates a field that has already been filled in with patient data, in this case, age and genetics. Blue writing indicates a field with normative data. These default values are intended to make it easier and faster to use TreatGx for the first time. Some conditions that require more personalized information to generate safe and effective treatment options have patient information sections that are highlighted in red. This means they must be completed before you can generate medication options. Most conditions will ask for information such as kidney function and liver impairment. If you prefer, you can keep the normal default values for these fields, but remember that the medication options and doses may not be optimized for your patient. Other conditions ask for weight, height, lab values, or genetics. Genetic results are automatically pre-filled and cannot be changed if you have had the TreatGx pharmacogenetic test done. Age is also unchangeable as this is generated from your birth date. To answer the questions, click the plus symbol in the red sections to expand each section. You can also change the responses in the other sections by selecting the plus symbol to the right. A list of questions or statements will appear. You can select all that are relevant and apply to the patients. If none apply, select none of the above. The more accurately and completely these questions are answered, the more precise the medication options that are generated by TreatGx will be. Once a blue field has information changed in it, it will become black to indicate that the information has been entered or changed. If I change symptom severity to moderate to severe from mild, the writing will now appear in black text. There are two actions that certify that the information being entered and used is correct. One is by entering or changing the information in a field. The other is to click the Create, Update, Personalized Medication options, the blue button at the bottom. This indicates personalized medication treatment options, or this generates personalized medication treatment options and acts as approval that all information entered is correct. Once you have filled in or changed information, it is saved not only in that condition, but also in other conditions that ask the same questions. Once all information fields are black or blue, click the Create, Update, Personalized RX option button. TreatGx will use the information entered to generate a list of dose-adjusted medication options for treating that condition. A list of medications will appear, along with instructional banners at the top of the list for more information on treatment options. As you can see here, there are some important alerts about a couple of the medications included. If you want to see more information about medications that are excluded or other options, scroll to the bottom of the medication list and select Other Therapy Options. In this case, you will see that the medication called famotidine has been excluded because this patient has already tried it and they stopped using it because it was causing side effects. If you do not want to see this information anymore, click Hide Other Therapy Options. The other feature you will see in most algorithms when you click Other Therapy Options is Next Line Therapy Options, the medications that are not preferred as a first choice but could be considered later in therapy. This is an example from hypertension showing second-line medication options. That's all there is to it. Now you can use TreatGx2 to get the right medication right from the start. Thanks for watching.